mobile surgery's moved to Peterborough now and I'm really excited to be here. I've never been to Peterborough before. I'm excited to see what sort of patients they are, what sort of practice I'll be working in for the next week. It's a whole new experience for me.
Working in Peterborough is a really positive experience, offering more face-to-face appointments for patients to help out local practices. There is a bit of a backlog following the COVID pandemic, and so being able to offer some extra capacity in the system is really rewarding.
There's diversity in the people we meet and variety in the work we do. In a clinic, you could start off seeing a newborn baby that's 3 days old, and then the next patient could be a 90-year-old patient. There's always something new to learn in this job.
There we go, perfect. Is it Jacob?
Yes.
Brilliant. You'll be seeing Debbie Harris today. If you'd like to take a seat, she won't be too long.
OK, thank you.
I'll take this off.
There you go.
How old is he?
15 months.
Oh,
yeah,
lovely.
so...
Oh, nice. Hi. This one?
Morning. Hello. Hi there. Is this Jacob?
It is.
In you come, my love.
Thank you.
Hello.
Thank you.
I'm Debbie. I'm a nurse practitioner. Oh, dearie me. Dearie me, what's happened to you?
Yeah.
Yeah?
So at the weekend, he came out in a rash. He was a bit poorly before. I thought it might be hand, foot and mouth. So we had but I wasn't sure. We had a face-to-face appointment with a GP on Monday who said it wasn't because there wasn't any on the palms of his hands. Said it might be a general viral rash and gave Fusidin cream for his face. However, the blisters are still there. If it's not hand, foot and mouth, my first worry is that it might be some kind of allergy or something. And we're on day 4 of 5 of the Fusidin and he's still quite red raw and weeping.
Yellow, wet crust, yeah. Well, I think we can be pretty confident today that this is hand, foot and mouth.
Right.
When it first starts, you can't be sure. So hand, foot and mouth is caused by a virus and it's very infectious. It's very... no. You're gorgeous, aren't you? Sometimes they're a little bit poorly. Often they're not that poorly. It gets better on its own. If you look, that there is a classical hand, foot and mouth type blister. It's amazing how the little ones tolerate it. Out!
Yeah.
You're clever, aren't you?
And I think the other thing is because he has spots all over his body, they are more concentrated in here, but I didn't know if that was linked to hand, foot and mouth.
You can get them everywhere.
Can Mummy have your arm?
You're lovely, aren't you? Yeah, he's got a couple of spots there.
They just look like that all over.
Yeah, no, I'm...
There, look.
Yeah, that's a classic. I'm very confident this is hand, foot and mouth.
OK.
I think... Has he had a temperature?
He did have, not for the last few days.
That's gone down now.
Yeah.
I think the thing that is just a little bit different with him, when he saw the doctor a few days ago, we sometimes worry that the blisters can get infected. And they get a thing called impetigo, which is a bacterial infection of the skin. And if you look around his mouth, he's got a lot of the wet spots that are leaking wet fluid and yellow crust. And that's a bacterial infection. So it doesn't matter. It'll be absolutely fine. Look at him, he's full of it, isn't he? He's full of it, aren't you?
Wriggly.
Yeah, what's this? Oh. Oh, ticka. Yeah, you're gorgeous, aren't you? Yeah, you're gorgeous. So he's not likely to get any more poorly. I don't think he's even got a temperature, but I'll check it. But I do think he probably needs some antibiotics for the spots around his mouth. What's this? What's this? Oh, he's so clever. Good boy. No, that's fine. It's completely normal. And is he drinking?
Yes.
Yeah. Any spots inside his lips, or you think his mouth, he's got any on his tongue, you can just put some baby Bonjela on. So often these skin infections, you need to have some antibiotics that you take. And I'll send you a prescription to the chemist. Yeah, is that OK?
Yeah. Say bye-bye.
Bye-bye.
You're good at your waving usually, aren't you?
He said, yeah, well, I'm not waving today. OK. Lovely to meet you.
Thanks so much, you too.
Bye-bye.
Bye.
Hello?
Hello.
Is it Michael?
Yes.
Here for Dr. Baycraft. Just take a seat and she'll be out in a minute.
Thank you.
Hi, is it Michael? Yes. Hi, come on in. Come and have a seat. I'm Dr. Baycraft.
Thank you.
OK, how can I help you today?
I've discovered a lump, a swelling on my groin.
OK.
I've had it for 3 or 4 weeks. It comes, it goes, but obviously I just need it checking out just for peace of mind. Yeah.
Why did you first notice it? Was it something you could feel, or was it that it was pain?
Yeah, sometimes it can be a bit discomforting when I go to the bathroom, you know, go to the toilet.
As in to open your bowels or to pee?
Yes, to pee.
Yeah, OK. And is it something that's there all the time, or does it seem to disappear?
It just seemed to disappear and come back, yeah.
It's got its mind of its own?
Yes,
OK,
yeah.
fine. Shall we have a little look and see what's going on? Okay. We'll do a bit of everything to start with then. So I'll just pop some gloves on. So can I get you to just undo the top of your trousers and things for me?
It is kind of there, look.
Oh, yeah. OK, so that's what you've noticed.
Yeah.
And if I get you to give me a big cough. Yeah, so you can see that there's something popping out there. OK.
So I found a lump behind my ear here.
I've got a lot of lumps at the bottom of my back.
The lumps that we're feeling here feel like sort of little fatty lumps that kind of sit under the skin. A couple of weeks ago, I found a painful lump in my armpit.
Yeah.
Got, I believe it's a cyst on my lower back.
OK.
So I thought it'd be best to get it checked out.
Does it look like kind of
I can't see it particularly, but obviously
Right.
I've looked in the mirror and I can't really see them. I feel nice and round, which is nice and reassuring because round things are normal.
Is that quite sore there?
It's a bit delicate.
That's sore, is it, if I press?
It doesn't hurt or anything.
No.
But yeah.
Very interesting position. It's quite low down.
To me, don't bang it with a book.
With a Bible, as they say.
Oh, is that what they say?
Tradition says, yes, right.
And I'm going to get you to come and lie up onto the couch as well. Have you noticed any kind of swelling down into the scrotum at all?
No, I haven't, no.
Okay. So I'm just going to lift this one up and have a little feel of your tummy, OK? So if I press on here, that feels OK?
Yeah.
OK, so give me a big cough again. And again on this side. OK, brilliant. Pop yourself all back together.
OK.
So I think actually it's what we call a hernia. So we have our abdominal wall muscles that kind of come down the front here and help keep all our organs in place. And particularly here, there's a little weak spot where there's naturally the muscle isn't quite so strong. And sometimes what can happen is a little bit of the tissue from underneath can kind of poke through.
Okay.
Sometimes they're very small and they just stay there, but sometimes they can get bigger. And the risk with them is that sometimes the little bit of bowel that comes from underneath can come through and then get stuck and then can't get back to where it's supposed to be again. At the moment, yours is nice and soft, it comes and goes and it's all fine. But what we might need to think about doing is referring you to see somebody to see whether we might need to consider surgery.
Okay.
So the first thing I would do is get an ultrasound scan just to confirm that's definitely what it is. Have a little look at it and see, is this hernia and how big is it? And then we'll go from there.
Okay.
In the meantime, you will notice that if you're picking up heavy lifting kind of things like that, or pushing and pulling and things like that, it might make it worse. That's okay as long as it doesn't kind of suddenly become painful. If it does become painful, then you need to take yourself off to hospital quickly, because then that could be an emergency kind of thing in that case. Does that all make sense?
Yes.
I will get the ultrasound scan arranged for you. They will contact you and give you an appointment. So they will see what's going on and then we'll go from there. Is that okay?
Yeah, that's great, thank you.
Perfect,
Yes.
okay, leave it with me.
Okay, thank you very much.
Have a good rest of your day.
Thank you.
Bye.
Bye-bye.
Hello.
Hello.
How are you guys?
Fine, thanks.
That's good. Are you here for the 2:40 appointment?
Yes. Yes.
With Dr. Shree. Great. If you just want to take a seat, we'll be out in a minute.
Thank you.
Afternoon.
Hi.
It's Dr. Shree. Please come in.
Thank you.
Hi, have a seat.
Thank you.
Thank you.
Hello.
Thank you.
Right, so Margaret, is that right?
Yes, that's
Okay,
right.
Hi.
Yes.
And
Ken.
your name?
Ken.
Okay. Hello.
Yes.
So, how can I help?
Well, the last sort of year and a half, I've had little sort of wobbly spells, and I've had 4 quite serious falls. I mean, one's breaking my ankle, one's tearing the rotator cuff.
Yeah.
But a couple of weeks ago, I was just walking in the lounge, and I don't know what happened. I can't remember anything, but I ended up on the floor all bruised.
Right.
He's more worried than I am, obviously.
Is that because of your past?
Yeah, I had quite a mild stroke a few years ago.
Yeah. So, okay, and then did you have more episodes after that?
No,
Right.
I've been absolutely fine.
So when you get wobbly on your feet, is that when you do a particular action, or...?
My husband has knee problems, and I have to walk with him slowly. That's
when I... Right. So that's been the case for some time?
For about, what, a year and a half, 2?
Year and a half,
Yes,
okay.
yeah, 2.
People often connect with symptoms, and it can be very hard to understand what is serious and what is normal. In which case, this is why we're here as professionals, to try and work out what are the relevant symptoms and signs that might need investigation. So I think it probably is more consistent with that you might have had a bit of a funny turn or faint, but I'll examine you if that's okay. So just to test your coordination, can you put your hand like this and then go back and forth? Keep going as fast as you can. And then do the same with the other hand. Okay. So do you feel there's a difference?
Yeah, this hand is well, since then, has always felt not quite.
I think that's what I could see evident, that you were left with a bit of residual weakness. Can you stand up for me? Okay, good. So can you put your hands out for me? If you close your eyes for me. Okay, you can relax. So do you see, without your vision, you feel a bit more unsteady? And that's the problem that could be linked with what happens sometimes when you're going from one part of the room to the next. So it's to do with your what we call proprioception, is sort of balance, needing to know that the ground is there below you. But when you don't have your vision, you start to feel a bit rocky. So this is the problem that happens as you get a bit older. And for that reason, there are sort of clinics which look at balance and the risk of falling. It's called the Falls Clinic. I think we'll look into that a bit more.
Okay.
Because they can spend a bit more time on that and decide, if you need any further assessments. Any funny turns where, you completely pass out and she loses consciousness, or you do get that weakness on one side of your body, slurred speech, facial, all of those. Don't hesitate. 999's there for a reason, and that's one of them for sure. Okay?
Okay.
Thank you.
Okay.
Take care.
Yes, well, thank you very much.
Notes in a second.
Thanks for your time.
Bye-bye.
Bye-bye.
Goodbye. Thank you.
So something will come in the post.
Okay.
All right?
Yes.
Okay.
Bye. Very reassuring.
Yeah, very nice, wasn't he?
Rosemary, you'd like to come through. I'm Dr. Beecraft.
Thank you. What kind of doctor are you? Are you a general practitioner or a...
I'm a GP.
You've got some very arty furniture, haven't you?
It's very glamorous in here. Come and have a seat. How can I help you?
I get a lot of pain in all my body. I'm finding it difficult to get around, and I didn't used to a few months ago.
Okay. What's different from a few months ago? Where is it kind of feeling that it's not
I'm
right?
getting more pain, actually, in my body, and in my arms and my shoulder. All in my body seems to hurt.
So the pains that you get, you describe them in your
shoulders, my arms, my
both
fingers.
Shoulders,
yeah.
Let's have a little look at your shoulders and your arms. So if we slip your handbag off, I think that's kind of... There we are. Oops.
I have to say, you look fantastic for your 91 years.
Oh, thank you. I've just got to keep going. And as I said to the kids, never give up.
Good attitude. Show me what you can do with this arm. How much movement have you got? And that's as far as that one will go. And what about the other one? Okay, and forwards. Can it go any higher? That's kind of getting stuck there a little bit. Obviously, your movement isn't as good as it once was, but is it painful doing any of that?
I can feel it.
You can feel it. I just want to have a little feel, so let me just press on here. And do you need to ever take painkillers for this?
I take cocotamol.
You take cocotamol.
Yeah.
Does that
And I try not to take too many.
And are you taking it for these aches and pains or for anything else?
No, just for the pain.
Pains, yeah. And then if you just sit forward a little bit for me, I just want to have a little feel in your back.
Oh.
And is that all quite tender?
And I get pains in my arms, and sometimes I think to myself, am I having a heart attack? You know when they say you get a pain in the arms?
Tell me about that.
Well, I don't know whether it's just my tendons or what do you call it? I get pains here.
So in this part rather than the higher part?
Yeah,
Okay,
just round this part.
What do you think I can do to help you?
I don't know really. I don't know whether my medication wouldn't be amended. If it's something different.
Yeah.
Because sometimes the cocotamol doesn't work.
Doesn't help. Okay.
So I thought,
stop that.
Stop that. I just don't want to be a vegetable. So I just think, oh, well, come on, old girl, you're 91, 92 next time. That's quite a good age, really.
It is really good.
Yeah.
The difficult dilemma that we've got is that we need to find a way of controlling your pain for you without giving you a whole host of other side effects. So what I was going to suggest is that we get you to have a blood test done. There's a particular condition called polymyalgia, which gives you weakness in both of the arms, makes them quite stiff and achy and painful.
That's what I thought.
If this blood test is normal, then there's a completely different family of medication that we could try to help with your chronic pain. It's a bit different from your normal painkillers, and that might be helpful.
That's the main part of me, is chronic pain.
Yeah.
Really, the rest of it...
Everything else pretty good and sharp by the looks of things. It's just this pain that's stopping.
Yeah. Do you think I'm sharp?
I think you're really sharp, yeah, definitely. So we need to get these joints and things a bit better for you. So what I'll do is we'll set up the blood test to be done.
Okay.
And then we'll see what the results show and make a plan from there. Good to go?
Yeah.
Brilliant, I'll grab the door for you.
You've got my favourite colours on.
Oh, do we? Oh, thank you.
Yeah.
That's the...
Yeah, I love purpley things. Purple and pink.
Oh. Well, you're in the right place.
Hello.
Hello.
Welcome to GP's mobile surgery.
Thank you very much.
If you'd like to take a seat, shouldn't be too long.
Thank you, thank you.
No problem.
Thanks.
Do you live nearby?
Not too far. Usually walk here, but I can't walk with my bad leg at the moment.
Hopefully it'll be on the mend soon.
Yeah, I hope so.
Hi there, is it Mohammed?
Yes, thank you.
In you come, my love.
Yes. Thank you.
Don't rush, just take your time.
Yeah.
That's all you can do, eh?
Yes.
So, my name's Debbie. What can I do for you today?
Well, I got a very bad leg.
Oh, you have, haven't you?
Yes. This, comparing to my right, the left is all in a bad state.
How long's it been like this?
Well, I've been to Umrah, which is Saudi Arabia, and going to Mecca. I had to go around that black building 7 times, and after sleeping for 2-3 hours, just resting, and when I got up, I couldn't put my heel down on the ground. Thought somebody knocked a nail into it. It was that bad.
Oh, when did you get back?
I got back last Thursday. Yeah.
So about 5 or 6 days.
Yes.
So walking's painful.
Yeah.
And where's the pain?
Pain is here in the calf and over in the ankles.
Right, okay. Because you've been on a long, long flight,
Yes.
one thing that can happen is you can get a blood clot in your leg.
Yes.
So we need to think about that.
Yeah.
And the other thing that can happen is you can, because you've got these areas on your leg that are sore and that are open, you can get infection.
Yeah.
And that's why it's red and sore.
Yeah.
Mohammed had recently gone on pilgrimage to Mecca and Medina, so he'd have had 2 very long flights. Patients who've got DVT present with a swollen, painful leg that feels very tight. It's really important to treat this quickly because the blood clot from the leg can travel quite quickly into the lungs and cause a condition called pulmonary embolism, which sometimes can be fatal. But I'm going to have a right good look at your foot, and then I might bring in my colleague because he's a very clever doctor and we'll make a decision to see what we think. Is that okay?
That's all right.
Oh gosh.
It looks red, certainly, and it's warm.
That looks like a blister or something come up there.
I have difficulty in keeping my knees bent like this for any period of time.
Got restless leg syndrome through fibromyalgia.
If I stand like that, I can lift that one, but I cannot lift that foot off the floor at all. And I've been limping like a lame dog, to be honest.
Restless legs, notoriously difficult to treat.
We know all about restless legs.
I've had restless legs and...
Your legs are permanently moving, and when you go to bed, you're like, you just got to move your legs all the time, else they get painful.
When I was running a lot, I had some restless legs. I was still running at night in the bed.
I've been in a washing machine at night.
Horrendous.
Are you able to do stairs okay?
I can do stairs, yes. Yeah, it's just a bit of a struggle at times, but my motto is use it or lose it.
This is Dr. Chris, who I've told you about.
Hiya, pleased to meet you.
Nice to see you.
And this is Mohammed, who's just come back from his pilgrimage, and this came up when we were about halfway there.
OK. So whereabouts does it hurt the most?
If you
at the back here.
It's bright red behind.
Very red, isn't it? Yeah.
And on my ankles.
OK, just bend your knee a little bit. That's right. That feel OK, does it?
That hurt a bit.
Did it? Whereabouts?
On my ankles.
Just here?
Yeah.
Oh, okay. There could be a bit of strain to this, where you could have strained the muscle, repeatedly strained it, and then it eventually swelled up and flared up. But I think we've got to exclude a thrombosis, a clot in the leg. I think that's the important thing to exclude.
So how do we find out whether we have a clot or not?
I'll leave you in Debbie's capable hands.
I'm going to have a look. And
okay, thank you.
Yeah.
Right.
Thanks very much.
Let's have a look here. So how long have you lived in Peterborough?
52 years.
Wow. So have you got children?
I had 4. I lost one 9 years ago.
Oh, I'm so sorry.
Very severe asthma attack.
Oh.
Pain doesn't go.
No, never. I'm so sorry.
And I find it hard to talk about him.
Oh.
I think no children should go before their parents.
Oh, hi there. I have a gentleman with me at the moment, a 69-year-old man who has possibly got a DVT.
Okay, that's no problem. Just give me 1 second.
Thank you.
So the first available that we've got is the 3rd.
Right.
And it will be at 8:40.
Right.
Yeah, I can do that.
8:40, that's fine. Okay, all right, thank you.
So
okay, no problem.
would you take details where I've got to go? And
Right, I'll get that for you. Right, I want you to go back into the surgery and go to the waiting room.
Yeah.
And I'm going to ask somebody to check your bloods.
All right.
Okay? All right, my love.
Thanks for your help.
Okay, no worries.
You're a big help.
Bye-bye.
Bye, thanks.
Bye-bye.
Morning, mobile surgery.
Hello?
Hello?
Is it Susan?
Yes, it is.
Here for Dr. Ward. If you just want to take a seat, she'll be out in a minute.
Thank you. It's nice and warm in here. It's cold out there today.
Hello, is it Susan?
Yes, it is.
Come through. Come and have a seat. Hi, I'm
Thank you.
Rachel. I'm one of the doctors.
Hello.
Right. What can I do for you today?
Well, I have this awful scabby places on my collarbone.
Yeah.
And I'm a bit worried they may be cancerous.
Okay.
Both my parents had cancer. And I've had a full blood test recently from the surgery here, so I know I'm okay, but it's still worrying.
And has anything changed with them recently?
Well, they're gradually getting larger.
Okay.
Yeah.
All right. Have you had a lot of sun exposure over the year?
I was terrible. I was a really bad
Were
sun
you a bit of a sun worshipper?
Yeah, so I know I've probably done it myself, yeah.
What I'm going to do is I'm going to have a look at them with this kind of magnifying glass with a light called a dermatoscope. Is that all right?
Yes, of course.
To kind of zone in on some of those areas.
Thank you.
So let's have a look. You have definitely got some sun damage.
All this horrible stuff.
So you've got a bit of a mixture here. And these raised areas are the ones in particular that you're worried about, I think, isn't it? Yeah. Okay, so I'm just going to have a look closely with those. I'm just going to have another look at a couple of other areas. Is that all right?
Under there?
Let's have a look at that bit. That's a bit of an awkward one. Let's... Yeah. Yeah, okay. So what the raised bits are, and you've actually got a couple here, it's something called a seborrheic keratosis. Now, these are common, and they're not cancerous.
Oh, bless your
okay?
heart.
Keratosis means warty. They're not warts, but they were kind of named like that because they're kind of rough. Some people have them kind of shaved off if they're really big, and they can get quite thick and scaly as well, but they're not worrying.
Okay.
You have certainly got some skin changes on your chest, which is kind of sun damage.
Yes.
You do need to keep quite a close eye on it.
Yeah.
So if there was anything different, you know, if you noticed a different colour, if you noticed any bleeding, or just anything, it's just always better to get it checked out. And the fact that you've kind of, you know, exposed yourself to the sun in the past, it's still really important to wear sunscreen now.
Yes, of course.
So you can still protect your skin going forward. So do make sure that you're wearing a high foot.
I promise. Oh dear.
Great. All right. Well, do pop back if there's any issues, but I'm happy with that.
Very kind of you. Thank you for your
Is that all right?
reassurance. Bless you.
No problem. Let me get you out.
Thank you.
See
You've
you
made
later.
my day.
Oh,
Thank
nice
you.
to see you.
And
See
you.
you
Thank
later.
you. Thank you. Bye bye.
Oh, yeah.
Hello,
You all
welcome.
right?
I'm good. How are you?
Thank you.
Excellent. I believe you're here to see Dr. Beecraft. If you'd like to take a seat, she won't be long.
No worries. Brilliant. Oh.
Hi, is it Jack?
Yes,
Hi,
yeah,
come on
come
in.
through. Oh, God, that got me. That did.
Come and have a seat. Hi, I'm
Thank
Dr.
you.
Beecraft.
Oh, yeah. Oh, God.
Alrighty. How can I help you today?
Well, basically, I've just got a really bad back.
Okay.
I mean, I've had bad backs, sore backs in the past.
Yeah.
But it's the worst I've ever had. It's taken my breath away. And I had a fall at work about 4 weeks ago, and I fell on my side and my back. I fell on something metal. I had a humongous bruise come on my side, and this was just tender. But as of last Saturday, I've woken up and it's just like, it's rock hard at the bottom, you know, and it hasn't come loose.
Okay.
I can press on it and not get no pain, so it feels like it's deeper. Like, I don't know,
Okay.
you know.
And is the pain just in your back, or does it go anywhere else?
It's mainly in my back, but I find in my hip I get a lot of pain in my side.
When do you notice it most?
It's constant.
It's constantly there.
I'm not going to lie, I can deal with pain quite well.
Yep.
But this is awful.
And what are you using to manage the pain at the moment?
I've had paracetamol, cocodamol paracetamol, ibuprofen gel, tiger balm, amitriptyline.
Yeah.
Someone gave me them for painkillers, they didn't do nothing.
Okay.
Codeine, someone's given me them for painkillers, they didn't do anything.
Okay.
It's what people at work have had prescribed, and they've just sort of
so
said, give this a go, it might work, it might not, and yeah.
And work, what do you do?
I'm a vehicle fitter. I build lorries, pretty much.
And how have you been doing at work with this?
It's awful.
Okay.
It's awful.
Can I get you to stand up for me?
Yeah, of course.
Sorry, I know that's probably going to be a
No,
bit
it's all
sore.
right. I find sitting as well, like I can't lean back or lean forward. I'm stuck upright.
Are you more comfy kind of being up?
Yeah, 100%. Yeah. It's just deep heat and tiger balm
Yeah, I can
and stuff.
smell.
Yes.
Because I know it's fine, I quite like the smell. Okay, so I'm going to just press down your spine. So let me know if I do anything that triggers any pain for you. Down here, that's okay?
It's a bit tender, but it's not painful.
Yeah, okay. So can I ask you to try and bend forward to touch toes?
That's as far as I'm about to go,
okay.
to be honest.
Bring yourself back up again.
That's it there, yeah.
So it's all really, really solid here, isn't it? Which is fine. And before this bad episode where you fell, it sounds like you've had some other episodes.
I was a bricklayer for 10 years, and it's very common in that job to, you know, have a bad back. And I'd never really suffered with it. I had it more in my hips.
Yeah. So essentially, I don't think you've done anything significant to the backbone itself or any of the discs in between. I think they're all kind of healthy. Where it's going wrong is all the muscles that support the back have just gone into spasm, and they're holding everything super, super tight. They're trying to be helpful and protect your back,
fine,
but actually all that tightness then stops you moving and makes it really painful to try and do anything.
Deep heat hot water bottles are the most relieving. Or stretching, if I do a nice stretch.
Exactly. So things like that is probably where we're going to make progress with this. So keep going with the deep heat and heat pads and things like that. They're all really helpful at relaxing the muscles. If you can bear it, if there's someone at home that can give you a bit of a massage or something.
Maybe Mrs. could, but I've told her don't use your thumbs because you kill me. Just do circles with your fingers.
Just a little bit might help. Just relax those muscles a little bit. And then what I'll also do is when we're finished is message you some particular stretching exercises that will help to loosen up the muscles and get things moving again. So that will help. So what I'm going to suggest we do is I give you a very short course of a muscle relaxant medication called diazepam. The reason I'm giving you such a short course is it can be quite addictive, so I'm just giving it to you for 2 or 3 days.
That's
but I'm
perfect.
hoping
It'll
that
clear
will
up,
clear
and
up.
it will help allow that to heal.
And that will allow you to move. So it's not going to be an ongoing thing. It will just help to blitz it just now.
To be honest, I've been saying this with the tablets. I don't like to take tablets because I find it's best to let your body fight it. But I'm in agony. I've got to take them at the minute. So I'm glad that you've shortened that, so it's not too long.
So it's just a few days of it, and because of the way it works, it will make you maybe a little bit sleepy, so you can't drive and you can't do...
I won't take them at work.
No, and you can't take them whilst you're at work in particular. And the best thing for you is keeping moving. So as you've noticed, when you're still, it allows everything to seize up. So try not to sit down for too long, just kind of get up and stand up and just stretch a little and then kind of sit down again if you have to do
I said this to my missus yesterday. I got home and I said I feel better. I've not had a bad day. I've watched it. Within a few hours, it'd gone from a point like that to like that, you know, and it was like, I can't understand, but you just made sense. So that's brilliant.
Fab.
Diamond.
All right.
Thank you. Brilliant. Thanks for your help.
No problem.
Oh, God. Here we go.
Hope it helps. Keep moving.
Yeah. Bless you.
Okay.
Thank you.
Bye.
You're right.
Thank you.
Hiya. Welcome to the mobile surgery. Is it Norma?
Yes.
Cool. So you'll be seeing Dr. Harris just in that room. So if you'd like to take a seat.
Okay.
Hi, is it Norma?
It is.
Hi,
yeah.
come on through.
Okay. Thank you.
Come on in. That's fine. I've been doing a bit of background reading.
Oh, I don't envy you.
So I'm Dr. Harris. How can I help you?
Well, I had cancer of the base of the tongue.
Yeah.
That's 5 years ago now.
Yeah.
The doctors thought that it was a sore throat, and I did, to be honest. I went to the doctors and he said, you need to be investigated. And the doctors sent me to ear, nose and throat. And I had this lovely young doctor. She was super, not a consultant. And she found it.
And she spotted it. Well done to her, eh? So what symptoms were you having? You were having a sore throat, you mentioned.
Yeah, struggling with speaking, but coughing.
Are you coughing anything up, and were you coughing anything else? No. Is it just an irritating, is it a dry cough?
It's a dry cough,
throat?
I ended up having to spend ages in hospital. So I had a pretty horrible time.
Yeah.
And for the last 3 weeks, I've got the same symptoms as when I first went to the doctors.
Right.
I don't want to go through it again.
No.
Every morning he'll be like...
He got a cold about Sunday.
Over the last 4 or 5 days, he's started to develop a cough.
And then last night, I thought she sounded really wheezy, and like maybe it's moved.
It started to progress a little bit more, so
Good.
It's been keeping him up at night.
It's still very noisy in there.
OK, sweetheart. Good boy.
I know. Oh, can I have my stick?
If you don't mind opening your mouth for me and saying, ah.
Ah. Say, ah. Ah.
Anybody notice anything with your voice?
Yeah, people are saying what's wrong, you know, it's worse than it has been.
Is it?
Yeah,
right.
Oh yeah.
Let's have a little look then. Listen at the back. While I'm behind you, I'm just going to have a feel of your neck. Did you have any lumps when you first presented?
No.
No. Feel now. And then we'll just have a little look at the back of your throat if we can. Right, let's have a little look. If you open your mouth wide, OK. OK, and if you lift your tongue up and then go that way. Great. And then the other way. Great. And then I'm just going to pop your tongue down a little bit. Well done, well done. OK, I'm not seeing anything that's causing me concerns that makes me think it's new. I've looked at your letters and you're nearly at the cusp of the 5 years, which I think probably also has maybe focused your mind as well. I don't think you're going to be happy unless you get another camera test, and I can understand that. I can't see anything today that I'm at all concerned about, but I can't see behind your tongue where your previous problem was. I'm optimistic that they'll have a look, and sometimes it's just a bit of worsening inflammation that can come periodically after radiotherapy.
That would be good.
And then that can just calm down again. So I will get on and arrange all that. Anything else I can help you with today? No? No?
No, that was enough.
Yeah, plenty, isn't it?
Yeah.
Good. Right, take care. All right.
Brilliant.
Thank you.
Thank you.
You okay there?
Yeah.
Cheers.
Okay.
See you then.
Bye. Bye.
Hiya.
Hello.
Welcome to the mobile surgery.
Thank you.
So you'll be seeing our AMP, Debbie Harris, just through there. If you'd like to take a seat for a quick second.
Thank you.
No worries.
Hi, is it Michael?
Is it Debbie Harry?
It is, yeah. It's not Debbie Harry. If you're expecting her, you're going to be disappointed, Michael.
I'm not disappointed at all.
Take a seat, my love.
Thank you. Hey, yeah.
So I'm a nurse practitioner. What can I do for you today?
This thing's really bugging me.
Right. Okie dokie. And how long have you had it?
About 3-4 months now.
Right. And do you catch it on things?
I do, yeah. And then if I knock it, it hurts.
Yeah. Has it ever bled?
No.
Right. It's in a tricky position, isn't it?
Yeah, it is actually.
It is. I'm just going to have a look at it. I mean, I can be very confident looking at it.
Cut it off.
That it's nothing nasty.
No, skin tear.
It's a what? It's a what? So I think I will document everything, explain what it's like, and ask the doctors who do the minor surgery if they would be able to take it off. Right. I can't promise anything, but I think because it's on your elbow, it constantly catches and pulls, and it's a fair size, and it's not like with warts. You can file them, you can tie cotton round them, but that's got quite a broad base. Is it painful when you mess about with it?
No.
Just when it's caught?
I'm sort of halfway there now.
Yeah, it would eventually, but I will just... Okay. I'll send that referral there. I can't promise anything.
Yeah, okay.
Is there anything else I can do for you? Are you happy with that?
Yes, can you lose me a 5 stone?
Okay, if I could do that, I would be sat here, would I? Being Mallorca in a massive villa chilling out.
Well, I love my food.
It's hard, isn't it?
What's the point of life if you can't enjoy
It's difficult,
a good
isn't
meal?
It's nice if you can get a bit of a balance, but
But I do eat healthily. I'm Mediterranean. I'm Greek Cypriot originally.
Oh, are you?
You know, so...
Yeah. Just you try and focus on eating healthy and just have in your mind 5 portions of fruit and veg, more protein and less carbs and less fats.
I get my mind into it.
You need to get your head right around it first. Right. But you're only 72. You're a young man.
I'm happy to reach this age. I don't think I'll get this far. I really didn't.
Honestly, well, you have a lot more years left in you.
Okay.
That's pep talk over,
all right.
matey.
Thank you very much.
Okie dokie,
Yeah,
I will.
thanks,
Lovely to meet you.
Thank you, Debbie.
All the best, sir. Nice to meet you.
Thank you very much.
Bye-bye.
Bye-bye. Hey, nice
Thank
to
you
meet
so much. You too.
Have a good day.
You too. Thank you.
Well done, Catherine. Thank you for coming.
No, thank you for seeing me.
Lovely to meet you, sir.
And you too.
Okay, thank you very much.
Thank you.
Thank you. Cheerio.
Bye.
All the best.
Thank you.
Right, nice to see you. Take care, all of you. Bye-bye.
Okay, bye.
Lovely.
All right.
Thank you.
Great.
Cheers.
Okay.
Very much.
See you later.
Cheers. All right, bye-bye.
Working in the mobile surgery has been an opportunity to return to more face-to-face consulting, and we understand that across the country there's a huge demand to try to return to life as normal post-pandemic. It's been fantastic to help my colleagues. Every appointment is quite precious at the moment because it's very difficult for patients to get appointments throughout the country.
Swelling's increase and the pains on the increase. It's worse.
Worse now, yeah.
My mind is working like 100 miles an hour, thinking that I should just leave, actually. It's constantly questioning myself to the point where I'm just confused. It was unbearable about night. Whatever I did, moved, laid down, anything, it was hurting really much.
If I stand like that, I can lift that one, I cannot lift that foot off the floor at all. I've been limping like a lame dog, to be honest.